The fentanyl crisis has claimed many lives on college campuses across the country. Reporter Alexandra Coenjaerts reports on efforts to raise awareness here in Southern California.
Alex had maybe been experimenting 10 days at the time of his death. It was a very short time frame. Death was not on the radar.
Amy Neville, an advocate and spokesperson for fentanyl education, started the Alexandra Neville Foundation after losing her 14-year-old son to fentanyl poisoning. Alex was on the younger side of those affected. According to Families Against Fentanyl, fentanyl is the leading cause of death for individuals aged 18 to 40 in the U.S.
At the time of Alex's death, we thought we were parents in the know. I checked his social media. We went to the presentations at schools on drug education, and unfortunately no one was talking about fentanyl at the time.
Since 2018, there has been a 1,000% increase in fentanyl deaths in Orange County. In fact, 1 in every 5 deaths can be traced back to the drug. Experts at the Orange County Department of Education say social media perpetuates misconceptions of the fentanyl crisis.
When I ask really any audience, what do you know about fentanyl? The number one thing they say is, oh, it's the candy stuff.
Since the rise in fatal fentanyl poisoning cases, Orange County has introduced multiple initiatives, notably the One Pill Will Kill campaign, to bring awareness to the drug.
When we go out, we do some education. There's still, even then, many students and many families not really clear on this issue or what exactly is happening.
According to Neville, the biggest reason why these government initiatives have failed is because they spread fentanyl awareness without educating people about the reality of how the drug is obtained and used.
When I first started this work, people would say to me, oh, we don't have to worry about that. My kid would never do that. Well, here I am as a person whose kid did do that. But could your kid be the boy who's super nervous for a first date, a girl he wants to go out with forever, totally nervous, a friend hands him his Xanax to take the edge off and he's gone? So giving these very real examples change the way people think about these drugs.
While Neville is fighting for fentanyl education, universities are on a mission to provide resources directly to students. According to the National Institute of Health, the average victim of fentanyl overdose is college-aged or older.
Therefore, universities have the responsibility to provide drug overdose resources to students. After visiting Chapman University's public safety office right behind me, I was not given direct access to Narcan, yet was informed that it can be administered by a public safety officer themselves.
On campus, just in the last year, public safety has confirmed with me that they've actually administered 3 different doses of Narcan within just the campus vicinity. So that is just showing how prevalent it is even in our area, and that excludes, any possible overdose that could have happened off campus.
Chapman University's student government is currently working on a formal program to make Narcan and test strips easily accessible for students.
Comprehensive drug education is something that is a little bit controversial in terms of how we want to provide it to students. There's always the debate between providing students with the resources to keep them safe and enabling students to participate in activities that would not be safe. So we are always discussing how we can do both of those things.
According to a poll given by the Student Government Association, 91% of Chapman students do not know if Narcan is available on campus. By distributing Narcan to students, the University of Southern California has successfully disrupted the national increase in overdose deaths. Isa Gianna Tiempo began the Team Awareness Combating Overdose initiative known as TACO with other neuroscience students after seeing a number of classmates die from overdoses. TACO aims to give resources directly to students to combat the impact of fentanyl.
Overdose deaths were in the double digits. Since TACO was founded, we haven't had a single overdose death at USC.
Initiatives like TACO successfully model the implementations of fentanyl resources and education on college campuses.
The culture has shifted. The way we do this is by going to sororities and fraternities and training the entire house in overdose prevention by being able to recognize an overdose and know when to give Narcan. We also tell them about the dangers of fentanyl and why it's important to test drugs. And we also distribute fentanyl test strips on Greek Row every week, as well as on campus. So it's really around students all the time. They're seeing it everywhere.
Gianna Tiempo wants TACO's initiatives rolled out nationwide, teaching students how to administer Narcan and test fentanyl safely and effectively. The step before using Narcan is understanding fentanyl.
At the time of Alex's death, we knew about drugs, we knew about illicit substances, but when it came to counterfeit pills, we had no idea.
This is Alexandra Coenjaerts reporting for Chapman News.
That story was produced by Alexandra Coenjaerts, Tess Martinelli, and Vivienne Ayres, students in the Investigative Journalism course here at Dodge College.